by default, when the patient starts to repeat or when the family is aware, they're already in stage 3 of dementia.
Picking up symptoms early, because we have a notion, bude hai, memory problems to hoga hi. So I think we have to come out of that attitude.
The behavioral symptoms would typically be aggression, agitation, or psychological symptoms would be anxiety, depression, sleep disturbances.
Hi everyone, good morning. I am Vibha Singhal, CEO and founder of Sukoon Unlimited. We are dedicated to bringing emotional wellness to senior citizens. It's a beautiful morning to be here in Bangalore. With me is a very distinguished panel of top doctors at Apollo Hospital. We have Dr. Gurucharan, Dr. Steve and Dr. Roshan. Thank you for being here.
Thank you so much.
Dr. Roshan, would you like to go ahead and introduce yourself?
Hello everybody, and thank you for inviting and thank you for arranging this panel discussion, or we shall call it conversation. I'm Dr. Jain. I'm one of the senior psychiatrists for Apollo Hospitals, Bangalore.
I'm Dr. Steve, consultant geriatrician at Apollo Hospitals, Bangalore.
I'm Dr. Gurucharan. I'm a consultant neurologist at Apollo Hospital, Bangalore.
We are here today to talk about a very relevant topic and something that is becoming very, very prevalent in India today, cognitive health and dementia. And it's a topic that not many are aware about or educated about. So we would love for this conversation to be for somebody who doesn't know about the space and wants to learn more about what is dementia and cognitive health. Dr. Steve, it's assumed that when people grow old, a little bit of memory loss and cognitive decline is okay. At what point of time do you see patients coming to you with very early symptoms of cognitive decline or memory loss?
Until a few years ago, most patients would come to you when they start to exhibit behavioral symptoms. When they start to interfere with the family's harmony is when they come to you. But now there's more awareness is there. Patients do come with, my father isn't as sharp as he was before. So the awareness is more. There are a lot of patients who come with cognitive issues per se. Often they are buried under a lot of other complex issues that the patient has. This doesn't surface.
Typically, what are the early symptoms that they show, Dr. Steve?
It could range from forgetfulness, slowness in answering, difficulty to recall, and often repetitions. So by default, when the patient starts to repeat or when the family is aware, they're already in stage 3 of dementia. So anything earlier than that is a big tick. The earlier you can detect these, the sooner you can try and correct these issues.
And Dr. Gurucharan, what is dementia? How does one understand dementia?
So dementia is traditionally known to be a disease of the elderly or of the geriatric age group. It's basically a combination of loss of neurons in the brain, where in simple words we tell the public that the brain is shrinking, or in medical words it's an atrophy of the brain, in combination with certain important chemicals or enzymes or juices, what we very casually comment on as called as a neurotransmitter. So these neurotransmitters start to dry up in the brain. So all these finer activities like the cognition, memory, thinking, your language, your interaction, your social, emotional well-being is mainly taken care of by the size of your brain and the neurotransmitters in the brain. So when there is a loss of brain cell or a loss of these neurotransmitters, they actually present to us as what we call as dementia. In a very simple nutshell, this is what dementia is all about.
And are there different types of dementia?
There are many types of dementia. So the broad categorization would be dementia which is potentially treatable and the dementia which is degenerative. So when we say a potentially treatable dementia, see for example somebody has a significant drop in sodium over the last many weeks. So they may have memory issues, cognitive issues for the last few weeks, but then when we see everything is normal but for their sodium, salt levels in the blood. So we correct the salt levels in the blood and what appeared to be a dementia gets treated. Yeah. Vitamin deficiency, everybody talks of vitamin B12, vitamin D3 deficiencies. Thyroid, very common in Indian population, especially for some reason more common in Indian women than in men. So hypothyroidism is a medical term. So hypothyroidism is another cause of potentially treatable dementia. So these are treatable causes of dementia. When we come to the actual degenerative dementias, there are many types. The most common type of dementia that we see in our population is Alzheimer's dementia, followed by vascular dementia. There is a frontotemporal variant of dementia wherein psychiatrists like Dr. Roshan would get into the picture, where they would have predominantly behavioral issues than memory issues. So there are multiple types of dementia, but broadly yes, what is degenerative and what is potentially treatable or reversible.
And are there certain symptoms that any dementia patient shows, or are they varied?
It is varied and it depends on the etiology. See, for example, an Alzheimer's dementia is a classical example of dementia where they become slow, they just are laid back. A well expressive person who was very good with his finances and his mathematics suddenly becomes dull and retracted from the society, and they show frank signs of loss of memory. So this is a very slow and a gradual progression. So this is a classical Alzheimer's. When we talk of another entity of dementia called frontotemporal dementia, there is a totally change in the personality of the patient. Someone who was never uttered a bad word in his life suddenly becomes totally abusive. He can lose his night's sleep. He can be delirious. He can hallucinate. So there is a sudden change, not a sudden change. There is a gradual but a very obvious change in the memory and the behavior of the patient. So in such cases, it could be a frontotemporal dementia. Certain cases of dementia we see they present to us with fits or epilepsy, and this is normally an advanced dementia. So if you ask me, there are varied presentations of dementia, and it all depends on what is the cause of dementia in these cases and what type of dementia these patients categorize themselves into.
And at what point of time, Dr. Jain, should they visit a psychiatrist to take help?
As Dr. Adur very, very clearly said, that different types of dementia presents with different symptoms, and in early stages, especially in those coming to the hospital seeing the geriatrician and neurologist, in most cases would be with some kind of behavioral problems. Now, memory holds very dear to all of us. So when people have memory problems or there is a decline in your ability to remember, organize your thoughts, coordinate things and do things in a good manner, then they start to get disturbed and frustrated. So in a psychiatric clinic, we often get presented with what we call people call it behavioral disturbance. But now there is terminology which is used for dementia is behavioral and psychological symptoms of dementia, or BPSD, in which the behavioral symptoms would typically be aggression, agitation, or psychological symptoms would be anxiety, depression, sleep disturbances, and in some cases they can present with paranoia, suspicion, harboring doubts about family members, about the identity of people, about the intentions of people. In many cases they might be misperceiving what is being said and done. They can be misinterpreting what's happening around them on a day-to-day basis. In many cases they might start to hear voices, which is hallucinations we call it. So hearing things which is not necessarily occurring. So if it is in the hearing component, we call it auditory hallucinations. If it is in the visual component, for example, seeing things which don't necessarily exist, misinterpreting things that are not happening, then it's called visual hallucinations. So the hallucinations or delusions or having doubts can be broadly used as a word as psychosis. So people can present with psychotic symptoms in the at the initial presentation, or they can simply present with agitation and aggression. One must imagine that when there is a failing memory, then the disturbance and frustration is profound, because somebody who was independent, who was capable, if they're not able to do things, then they would get frustrated, and those frustrations would often pour into the family, often project onto people that they're close to, because you can't show it on other people. So the family often bring them to say that somebody is disturbed, somebody is getting anxious and agitated. You asked one of the questions earlier, it says that what are the different types of dementia? In psychiatric clinics, sometimes they purely present with memory problems, so forgetfulness. So for example, if somebody has got depression of significant nature, then they will have what we call as pseudo dementia, where the person is depressed, but they are not so much expressing depression, but what they're expressing is that they're withdrawn, they're isolated, they're speaking less, and they don't seem bright. They're dull from the time they wake up in the morning, and the dullness remains throughout. Now, when some of these people present, then we do send them to a neurologist, to geriatrician, to evaluate whether this is just depression presenting with memory problems, or is it dementia presenting as depression. And we then conduct further investigations and further evaluations to look at whether it is just depression related dementia or what we call as pseudo dementia.
And is dementia treatable, Dr. Jain?
Dementia from the psychological point of view, yes, very treatable. The pseudo dementia that I just mentioned about, which is memory problems, concentration problems related to depression, is very much treatable and reversible, because as we treat the depression, the memory starts to get better. When we are in a good state of mind, when we are enthusiastic and motivated, when you are attentive, when you are happy, then you are attentive. And attention is directly correlated with our ability to register things that we see and do, and that is directly correlated with recollection. So if you don't concentrate, if you don't attend to things, then you can't register and recall them. So people with anxiety and depression, if they are not registering things, then they tend to be more forgetful. And in many cases, in psychiatric clinic, not just with dementia, many people present with memory problems to say that I can't remember things. And the frustration for slightly younger people would be that because I can't remember things, I can't do things, and I'm not as good as I used to be. And in Indian setting particularly, I think presentation to psychiatric clinic and even neurology clinic is memory problems. So people cannot remember things. And it is for us to explore the potential causes for those memory problems. As you mentioned about the sodium levels, thyroid issues, depression, anxiety, and of course all the different types of dementias. So we need to look at in a broad spectrum of a person with memory problems, and then we look at cognitive evaluation, and then look at the underlying causes and treat accordingly.
You mentioned about different causes of dementia, sir. Are there any factors that increase the risk of moving towards dementia? For example, WHO spoke about loneliness being one of the reasons which can amplify the probability of somebody getting dementia. Are there more such triggers that one should be aware about?
Yeah, as a neurologist practicing, the most important things that can predispose someone to dementia is somebody has had a stroke. So in the recent past, he's had a stroke. Stroke is a clot in the brain or a bleeding in the brain. So their risk of developing a post-stroke dementia is definitely several fold higher than in a patient without a stroke in the past. Next, somebody who's had significant family history. So we have not spoken about the genetics or hereditary aspects of dementia. If someone has had a history of dementia in his first family, there is a good chance that he has to be a little more careful about his lifestyle, and he may be predisposed to developing dementia in the future. And yes, there are a lot of psychosocial aspects that can, I wouldn't say, result in dementia, because most of us are stressed in our daily living, and I'm sure 15 to 20% of all our life we would have been depressed or anxious in our taking the entire 60-70 years of our lifespan. So this doesn't really result in dementia, but it may predispose, because at the end of the day, any stress results in a raise in the cortisol levels in the blood and other hormonal changes. So we are not really sure what is a direct relationship, but then stress and anxiety and other psychological issues can predispose one to lose neurons and to even probably result in a reduction in the neurotransmitter levels in the brain. Third important thing is, you would have heard of brain infections, meningitis or encephalitis. There was an outbreak in the northern India a couple of years back. So somebody who has had a brain infection in the past, not everyone, but a few of them, the unlucky ones, can develop a post-encephalitic sequel, is what we call technically. They can develop dementia in the future. They can develop Parkinson's in the future. There is another entity wherein there is a set of patients, elderly patients with Parkinson's disease. These are the patients. About 30% of the Parkinson's patient can also in the long run develop dementia. So if you ask me, there are plenty of predisposing factors, but healthy lifestyle, again, alcohol, smoking, tobacco use, keeping your blood pressure under control, keeping your sugars under control, as it is for any other general well-being, these factors have to be considered for someone who is otherwise healthy to prevent themselves from getting into dementia in the future.
And Dr. Steve, for senior citizens especially, are there any things that they can do in their daily lives to manage the risk of dementia?
So people think dementia is about memory loss alone. Cognition and memory are connected. They are not the same. Cognition involves memory, executive function, ability to do certain tasks, and even social cognition, ability to involve and merge in a society. So when you speak about what the older person can do, often they find themselves lost after retirement. They are suddenly, from a busy life of hustle and activity, they have a lot of time on their hands and nothing really to do. This shift from the most important person in the house to the lesser important person in the house has a lot of effects on them, both physically and mentally. Some of them go into depression only because of this. And when they find their values or their worth isn't too much, that pushes them again into a corner. So the most important thing is to keep a routine. They need to keep a routine, and some of them even try and look for alternative means of keeping themselves engaged. This could be even a second profession. But the key is to keep themselves engaged in activities, and among the risk factors Dr. Adu mentioned, I would also add hearing loss, visual loss, and social isolation worsens everything. So the most important thing an older person needs to do is to connect. Often not just virtually, physically too. They need to go out, meet people, because social isolation worsens dementia. Involving in cognitive puzzles or something simple as reading or writing, drawing, painting. So dementia is, whenever I meet a patient with dementia, and when I ask about their personal interests and hobbies, if I come across a patient who writes or reads, that's something I can hold on to. We can leverage that and use it as a tool to bring them back or improve their cognitive capabilities. Vis-a-vis a person who's been cooking all her life. So, which is why it's important to develop hobbies. So these are some of the ways we can try and manage things better.
And for the entire, for all of us, just to understand this better, any advice for family members who are taking care of people with dementia?
So the first thing I say to my patients is, look at your parent. Often by the time they have realized that my father or my mother has got a memory problem, it's stage 4 or beyond. They have missed the stages. So they keep coming, patients keep coming with complaints of there has been a memory problem or a behavioral problem. When you probe, they tell, yeah, it was all good until 2 months ago. When you probe further, well, maybe in 2022. So when you trace the history back, it would have started about 4-5 years ago. So the first symptoms are most important. That's the most important thing a family member should do. And even a smaller problem, as it seems, may not be age-related all the time. They need to bring each symptom into attention and see what can be done, because there are ways to retard the progression of the disease. There are evaluations you can do and involve them at an early stage of the disease, so a disease progression can be avoided. Of course, and once the dementia has progressed, they need to spend more time, because a patient with dementia recognizes the son or daughter who stays with him and not the daughter who stays abroad, because they don't see them so often. So the person at home needs to engage more often and involve them in day-to-day activities, for which time is the most important thing.
In mental health arena, we often talk about prioritizing self-care. Now, this is very, very important, as you said earlier, that it is very, very important that we nurture and protect our mind and body in a consistent manner, so that we are constantly upgrading and constantly looking after ourselves through self-care, looking after our mind with relaxation, with meditation, with reading, with music, with learning and unlearning things throughout. We need to keep our body fit in such a way that we are become protected with illnesses and stresses and difficulties in life. Same principles will apply to the carers as well, that they need to look after themselves as much as they are caring for their loved one, because if they are not healthy, then they cease to remain helpful. And if they are not looking after themselves, then they'll find it very, very difficult to look after those who need most. So the carer stress is a very big thing, especially in geriatrics and in psychiatry, that once a carer is looking after somebody with chronic health issues, especially with dementia or physical health problems, then they get burnt out, they get worn out, and then that can lead to neglect of those who need most. So the carer needs to look after themselves so that they can look after the carer one. And equally, by looking after your mind and your body in a consistent manner, you are also shielding yourself from future illnesses, even dementing processes, memory problems in the future. Stress is one of the commonest cause for memory impairment. And as you asked very earlier, to say that how do we protect that? That if somebody is very much more relaxed, if they are not stressed, then their dementia will worsen slowly. If they are well looked after. So if you are a healthy individual, then the contributing factor to the cognitive decline in a dementia is slower or lesser. Associated behavioral problems and psychological impact is also lesser. So as you remove factors which can worsen your illness, then you tend to respond to treatment better. So you need to do a multitude of things in order to avoid getting deteriorated. And that's why you need multiple approaches, even for carers. So many of the carers just come to the psychiatric clinic just for advice as to what do we do with somebody who's at home and refusing to come to hospital. So I call that as proxy consultation. And that's quite a big number where people just come and say that, what do I do with my father who's ailing? What do I do with his behavioral problems? What do I do with his depression? What do I do with his hesitation in accepting help, accepting medicine, accepting food? So that becomes a big chunk of treatment in dementia care. The carer needs to be given significant importance because, especially in Indian settings, they are the principal providers for individuals, unlike in UK and US, where the government and social services are the principal providers in most cases.
And also, just to add, you were asking about the caregivers, what do they have to do? Picking up symptoms early, because we have a notion, bude hai, memory problems to hoga hi. So I think we have to come out of that attitude. If we have a minute, I'll just give a small story that I encountered a couple of months back. We had an elderly couple, and the son brought him saying he's confused since morning. The confusion was very simple. He picks out a couple of notes, currency from his pocket and says, somebody has put pink papers in my pocket and have lost my money.
Yeah.
The elderly gentleman has basically lost track that the Indian currency has changed its color. And like Dr. Steve mentioned, retrospectively, if you ask them, he lost track of his house. He went to another lane a couple of weeks back. Another blunder had happened a couple of months back. So retrospectively, if you trace, it was not budapan hai, to memory loss ho raha. He's actually getting into dementia. And when things went out of hand and when he created ruckus that he lost his money and he had some pink papers in his pocket, that's when everyone realized. So the awareness, the ironical part of this situation is in most of our OPDs, we have younger people coming, sitting with us and coming to us saying they have memory loss. At 25 years, they come and ask me, Doc, do I have dementia? But it's predominantly stress and anxiety which is making them come to a doctor.
Yeah.
But with the same enthusiasm, if they can bring their elderlies and monitor them in a better way and just not pushing it to the sideline, saying it is a part of old age. I think that's the most important take-home message. If old age was just something which we have to just pass off, and an important specialty like geriatrics would not have been existing at all. So that's some very important take-home message that I would like to give to all public, especially the younger generation, to make sure they monitor very carefully their elders, their parents or their grandparents, and bring them to the medical specialist at the right time.
Thank you everyone for this very, very insightful discussion on what are the different triggers for dementia, what causes it, how to manage it, what is dementia, just the understanding of it. And the key takeaway I'm taking from all of this is that we can, as a family and as individuals, do a lot to manage our own mental well-being, emotional well-being, to not only manage physical health but also cognitive health that can help us maybe manage the probability of developing dementia in the future. And social well-being and emotional well-being is equally important as physical well-being. So the need for social engagement, the need for meditation, music, taking self-care is as important as taking care of just your body. Right? Thank you everyone for a very good discussion.